morning to you. Belinda Mutibura. I am a second year student in the Department of Obs and Gynae with the University of Zimbabwe, as well as a first year executive student. I will be presenting a brief synopsis of my dissertation, factors influencing retention into screening and treatment for cervical pre-cancer in Harare, Zimbabwe. My co-mentors are Prof. Chilenje and Dr. Bothwell Guja. I would like to take this time to also thank you all for being here and for this opportunity that I have received to present in front of such a big crowd with esteemed colleagues. Outline of my presentation, I'll try to go as quick as I can so you don't have to miss out on the team. I also want to acknowledge the National Institute of Health and Care Research UK in collaboration with the Awaken School for Cancer Research. The Awaken ED actually stands for African Awareness of Cancer and Early Diagnosis. It is an NIHR-funded global health research group which focuses on advancing early diagnosis of cancer in Southern Africa. The team includes researchers from South Africa and Zimbabwe, working in collaboration with the team in the UK from the Queen Mary University of London, with the aim of advancing the early diagnosis of cancer in Southern Africa by developing and evaluating electronic tools to improve care seeking and reduce healthcare delays in Zimbabwe and in South Africa. In addition, the Awaken ED aims to strengthen research capacity in Southern Africa through training programs and mentorship. Despite the availability of cervical cancer screening services in Zimbabwe, there still remains a low uptake in these services, and retention rates in screening and treatment programs remain suboptimal. Furthermore, women who are not retained in screening and treatment programs face a higher risk of developing invasive cervical cancer, which could otherwise be prevented if identified and treated early. Understanding the factors influencing retention into screening and treatment for cervical precancer is crucial in aiding Zimbabwe in attaining the WHO cervical cancer 2030 elimination goals, also by developing relevant mitigation factors. Cervical cancer is the fourth most common cancer among women worldwide, and in Zimbabwe, cervical cancer is the leading cause of cancer-related deaths among women with a high incidence. In Zimbabwe, the incidence rate sits at about 62 per 100,000 women, which is 5 times greater than the global average, and this disease disproportionately affects women in low and middle income countries. And this is just further depiction to just show that the darker shaded areas are the ones with the highest burden of disease. Furthermore, in Zimbabwe, there is an age standardized mortality rate of about 46 per 100,000 women, which is nearly 7 times the global average. And the primary cause of cervical cancer is persistent infection with high-risk human papillomavirus, known as HPV. Furthermore, women living with HIV have a higher risk of developing cervical cancer due to the compromised immune system, which may affect their ability to clear HPV infections. However, cervical cancer is a preventable disease with effective screening and treatment of these precancerous lesions. The WHO World Assembly has developed a strategy for the elimination of cervical cancer as a public health problem. And the definition of elimination of cervical cancer is set up at a country profile reaching at least 4 cases of cervical cancer for 100,000 women per year. To reach this threshold by the end of the 21st century, the WHO has set up the 90-70-90 target to be reached by 2030 and to be maintained. So the first target states that 90% of all girls should be fully vaccinated with an HPV vaccine by age of 15. And the second target states that 70% of women should be screened with a high performance test by age 35 and yet again by age 45. And the last target, the 90% of women should have been identified with cervical, sorry, let me repeat that. 90% of women identified with cervical disease should have received treatment. And 90% of these women should have been treated for pre-cancer, and 90% should be managed for invasive cervical cancer. And to further support this, this initiative, studies have shown that there is a morbidity and mortality benefit to having organized screening, program. And this study will focus on the secondary prevention strategy arm, which is screening and treatment of cervical pre-cancer. My main study objective is to identify the factors that influence retention into cervical cancer screening and treatment programs in Harare, Zimbabwe. My specific objectives: the first one, to document the proportion of women who are retained into cervical cancer screening and treatment programs in Zimbabwe. Secondly, to assess the socio-demographic, behavioral, and health system factors, that affect retention into cervical cancer screening and treatment programs. Thirdly, to examine the role of the Champions Health Belief Model in explaining women's compliance with cervical cancer and treatment recommendations. Second from last is to document the time interval from screening to treatment in women who test positive on screening and are eligible for treatment. Lastly, is to compare the retention rates of cervical cancer screening programs between women living with HIV and those without HIV. I hope this research will provide valuable insights into factors influencing retention into cervical cancer screening and treatment programs in Harare, Zimbabwe. The findings can inform policymakers and healthcare providers in designing and implementing targeted intervention to improve cervical cancer prevention efforts. Furthermore, the study may contribute to the broader literature, of cervical cancer prevention in low to middle income countries, particularly in the context of women living with HIV who are at higher risk of developing cervical cancer. Overall, this study has the potential to contribute to Zimbabwe's strategy to eliminate cervical cancer as a public health problem, as the WHO second and third pillar. So this research will employ a mixed method approach, utilizing both qualitative and quantitative data collection and analysis techniques to gain a comprehensive understanding of factors influencing retention into cervical cancer screening and treatment in Harare, Zimbabwe. So this research will be conducted in two phases. The first phase will be a quantitative design, whereby I'll be implementing the health belief model as the primary theoretical framework. It was initially developed by Rosenberg and colleagues in the 1950s, and the health belief model is a socio-behavioral model that aims to explain and predict health-related behaviors, including compliance with medical treatment. The health belief model postulates that individual engagement in health promoting behaviors is influenced by the their perceptions of susceptibility, severity, benefits, and barriers related to the health problem. It was further modified by Victoria Champion through the years 1985, 1993, and 1999, whereby she was actually looking at breast cancer, but it was now been modified to the Champions Health Belief Model, which is fitting in many settings, as well in this context of cervical cancer. And this study will apply the health belief model to investigate factors influencing women's retention into cervical cancer screening and treatment in Harare, Zimbabwe. The qualitative data will be collected through in-depth interviews by a structured questionnaire constructed from the Champions Health Belief Model. The second phase of the study will be quantitative data done through a prospective study from clients from designated clinics in Harare for women who would have presented for cervical cancer screening. The data variables of the quantitative question are all women presenting with cervical cancer and cervical pre-cancer treatment will be willing to give consent. And the study period will be conducted as of August 2023 and or to August 2024, pending ethical approval. I will include all women who will be presenting for cervical cancer screening and pre-cancer treatment who will be consenting to the study. And I'll also include women who are asymptomatic of cervical cancer, given that in our population, women tend to present because they are symptomatic and not because they're coming in for routine screening. So hence why I'll be including women who are symptomatic and also excluding those who are clinically advanced disease at screening. And I'll also include health workers who also be willing to consent. And obviously, those who are not willing to consent will not be part of the study. My total sample size is estimated at around 549, factoring in a 20% possible loss to follow-up for those who would have presented, who would have declined treatment, and a possible 30% loss to follow-up for those who would have come for screening. To ensure the ethical conduct of the study, the researchers will obtain informed consent from the participants with respect for participants' privacy and maintain their confidentiality of the information collected, as permission will be sought out from the relevant ethical bodies. To ensure the validity and the reliability of the study, the research instruments will be pre-tested and modified as necessary based on the pre-test results, and the qualitative data collection will involve a pilot test with a small sample of participants who meet the inclusion criteria but are not part of the main study to ensure the clarity and the relevance of the interview questions. For the qualitative phase, the data extraction form will be pre-tested to ensure that it captures all the relevant information needed for this study. Standardized and validated data collection tools will be used to enhance the reliability of this study. In conclusion, the proposed research aims to identify and analyze factors influencing retention into screening and treatment for cervical pre-cancer in Harare, Zimbabwe. This research is vital to understand and address the barriers women face in assessing and adhering to cervical cancer screening and treatment programs. By employing a mixed methods approach, including both the qualitative and quantitative data collection and analysis, the study will generate a comprehensive understanding of the factors affecting retention into screening and treatment. The findings from this research have the potential to inform policies, strategies, and interventions to improve the accessibility, utilization, and effectiveness of cervical cancer screening and treatment services in Harare and in similar settings. Ultimately, the study results may contribute to the global efforts to eliminate cervical cancer as a public health problem, as outlined by the WHO organization. This research will not only enhance the knowledge base of cervical cancer screening and treatment, but also serve as a foundation for future studies in this critical area of women's health. Thank you very much.